Good afternoon, everyone. Thank you for being here today. Let me start by introducing myself. My name is Yui Nakai. I'll be explaining what tooth decay is and sharing the survey result we conducted.
Hi, I'm Kazuki Miyamoto, and I'll be talking about the symptoms of tooth decay and how to prevent it.
And I'm Ayaka Kasaki, and I discuss treatment option for tooth decay and wrap up our presentation.
Together, we'll talk about tooth decay, how to prevent it, and how to keep your teeth healthy. We hope you find this information useful and interesting. This decay begins when bacteria in your mouth break down sugars from the food you eat, producing acids that slowly dissolve your teeth. This happens in several stages. The first stage is called demineralization. The acids start to dissolve the enamel, the outer layer of your mouth tooth, and you might notice white spots, but there's usually no pain. As the acids continue working, holes start to form in the enamel, and you may feel sensitivity, especially to cold or sweet food. If the case spreads to the dentin, the layer beneath the enamel, the pain becomes stronger, particularly with not hot or cold food. Finally, if decay reaches the nerve inside the tooth, it can cause severe pain, and an infection may spread. In some cases, the tooth might need to be extracted. We conducted a survey to find out what people think causes their tooth decay. Here's what we found. The most common answer, with 66.7%, was skipping brushing their teeth. Next, 33.3% said drinking too much juice caused their tooth decay. 16.7% of people said snacking too often was the main cause. It's interesting that skipping brushing is the top reason, but it also shows that diet plays a significant role in our oral health. By the way, Kazuki, how many times a day do you brush your teeth?
I brush twice a day. How about you?
I also brush twice a day. It's a good habit to keep your teeth clean.
Absolutely. Let's move on the next slide to see how often people in general brush their teeth. So what causes tooth decay? There are a few main factors. First, bacteria in your mouth feed on sugars and produce acids that damage your teeth. Next, frequently eating sugary foods and drinks gives the bacteria plenty of fuel, which leads to decay. Poor oral hygiene is another big factor. If you don't brush or floss properly, plaque builds up and creates a perfect environment for bacteria. Lack of saliva also increases the risk of decay. Saliva helps protect your teeth. So if you are not producing enough, you, your teeth are more vulnerable. Finally, irregular eating habits, like frequent snacking or eating at odd times, can also lead to tooth decay. We also surveyed how often people brush their teeth. The results were quite surprising. The responses were evenly split 33.3%. Brush once a day 33.3%. Brush twice a day and 33.3%. Brush three times or more. It's interesting to see such an even distribution in brushing habits. So what are the symptoms of tooth decay? Here are some common signs to watch for. First, pain. You might feel sensitivity or pain when eating something cold, hot, or sweet. Tooth discoloration. You might Notice white spots or brown-black areas on your teeth. Chipped teeth or holes are clear sign of cavities. Bad breath can also appear as decay progresses. Finally, swollen gums. Your gums might become red swollen and sometimes release pus.
We also survey how often people use interdental brushes or floss each day. 66.7% of people say they use them once a day, while 33.3% use them twice a day. It's clear that most people use them at least once a day, but using them more often would improve our oral health. Now let's talk about prevention. Here are a few key habits to protect your teeth. First, brush regularly with fluoride toothpaste after meal and before bed. Use floss or interdental brush to clean between your teeth and remove plaque. Visit your dentist regularly for checkup. Aim for at least once every 6 months. Limit sugary food and drinks, and if you do consume them, brush your teeth right after. Finally, drink plenty of water to stay hydrated and help produce saliva, which protect your teeth. Now let's talk about treatment for tooth decay. The treatment depends on how advanced the decay is. For early-stage decay, fluoride treatment can help remineralize the tooth. If the decay forms cavities, fillings are used to restore the tooth. For more advanced decay, crowns are placed to protect and restore the tooth. If decay reaches the nerve, a root canal treatment is necessary. In severe cases, if the tooth cannot be saved, extraction might be required. In conclusion, tooth decay is common but preventable problem. By understanding its causes, symptoms, and treatment, we can better care for our oral health. Regular brushing, flossing, and dentist visit are key to prevention. Also, paying attention to diet and staying hydrated can make a big difference. Let's take action now to protect our teeth and keep our smile healthy for years to come. Thank you for your attention, and if you have any question, feel free to ask. Bye.